Good morning, I am Sonia and I am going to start answering questions for chapter 13. The first question is, what are the major strengths and weaknesses of the following approaches to therapy? Psychoanalysis, person-centered therapy, behavior therapy, cognitive behavior therapy, and drug therapy. Psychoanalysis, therapy who practice psychoanalysis assume a more active role and decide whether, together with the client, on the issues to explore at the outset, rather than waiting for them to emerge in the course of treatment. Also, clients may require only 1 or 2 visits per week for as few as 12 to 12 weeks. The weaknesses of psychoanalysis is that psychoanalysis is not an exact science, and its conclusions cannot be assumed as definitive. Also, psychoanalysis works more effectively on clients who do not have multiple psychological disorders, clients who have fewer social relationship problems, and those who believe that therapy will be effective for them. Therefore, this therapy might not be the best option to treat more complex disorders. Now, the person-centered therapy, the strengths are the therapists that apply this technique or this type of therapy assume that people have the ability and freedom to lead rational lives and make rational choices. The person-centered therapist attempts to create an accepting climate based on unconditional positive regard for the client, empathizing with the client's concerns and emotions, showing willingness to communicate with the client and on a person-to-person basis rather than as an authority figure. Now, the person-centered therapy, the weaknesses of it is that perhaps it's too optimistic about human potential and people's ability to change. There is a lack of structure, and this type of therapy does not take into account the cultural implications and expectations, which play an important role on how to best approach the client. I think it is a very demanding approach for therapists, as they need to be capable and have great ability to adopt a genuine humanistic approach, which in many cases they simply don't have it. Now, behavior therapy, the strength of this therapy is that it sees behavior itself as a disorder instead of viewing maladaptive behavior as a symptom of some underlying disorder. In its short term, so it's cost effective for both client and therapist. And because it's a logic-based approach, it helps the client identify the underlying reason as to why certain behaviors occur and why the feelings are there. Now, behavior therapy, the weaknesses is that it's still a new model compared to psychodynamic counseling, and much of the research hasn't been compared to control models, but only on the individual outcome. Now, cognitive behavior therapy, the strength of this therapy is that therapists applying this type of therapy try to change maladaptive behavior that results from irrational thoughts, beliefs, and ideas. This approach has been shown to be effective for treating a wide variety of problems, including anxiety disorders, psychological drug dependence, and mood disorders. The 2 best types of cognitive behavior therapy are the Albert Ellis Rational Emotive Behavior Therapy and the Aaron Beck's Cognitive Therapy. Now, the weaknesses of cognitive behavior therapy are that the therapist needs to have a very high level, or the client needs to have a high level of commitment and involvement. Due to the structured nature of cognitive behavior therapy, it may not be suitable to treat more complex mental health disorders or learning difficulties. Drug therapy, the strengths are that it reduces involuntary hospitalization of people with psychological disorders. It lowers the mental hospital patient population in the U.S. from about 560,000 in 1955 when the drugs were first introduced, to about 100,000 by 1990. Now, the weaknesses of drug therapy is that any medication that we put in our mouth can cause a negative reaction. And drug therapy may have very scary side effects and lead to substance abuse and addiction.